and I'm from Canada originally. You got a question?
Well, were you able to get into the town hall?
No, I wasn't able to get in. I arrived here 45 minutes early, hoping to get in. We stood in line, and at about 6:15 or so, we were told that nobody else was allowed in.
Now, why did you want to come to the town hall?
Well, I mean, I've got a personal, I guess, a personal interest in healthcare. You know, it's something that's important to me, my health, and I want to have my say before things change for what I consider worse.
Now, you said you came from Canada. Now, do you still hold Canadian citizenship, or have you gotten American citizenship?
I'm currently still Canadian citizen. I'm a legal American resident, I should say. Mm-hmm. But, yeah, I just met my wife a year ago, and moved down here, so I've been here for a little over a year.
Okay. Now, from your experience with government-run healthcare in Canada, what has it been?
It's been pretty poor, to tell you the truth. Lots of Canadians will tell you that they're very happy with their doctor, and that's true. I was happy with mine. But that's more of a statement on the quality of my doctor and his service to me personally than it is over the system. The system itself is broken. I was saying earlier to people that, you know, the cost of running healthcare is very expensive, and the government has limited funds, and they take from you and I as taxpayers, and that well does run dry. And when you start working with, you know, 25-year-old X-ray machines and 15-year-old CAT scan machines, you know, are you really getting the best that you could be getting?
Now, you look like a relatively young and healthy person. Now, anyone in your family who has actually had to have a serious need for health care in the system up in Canada, what experiences have you had there?
Certainly. I had a friend, actually, about 10 years ago. Her mother got breast cancer. She was told that she had a 9-month wait for see an oncologist, which is the doctor that deals with the cancer. And she had to go home and think about what she was going to do. And, you know, do you really want to be told that by your doctor? You know, I had another family member who had to have a hip replacement, and that didn't happen for 7 months.
Now, with the current proposals, what are your biggest concerns?
My biggest concern is that things are going to end up like they are in Canada. I mean, from what I hear from the Obama administration, it's not going to end up that way. But looking at history and looking at the way that Canada went back in the 50s and 60s, you know, Canada was the same spot that we're at today. And there was 2 roads that they could have chose. And one was nationalized health care, and the other one was to reform health insurance as it was. They chose nationalized health care, that single-payer system, and they are where they're at today because of it. And every election, it seems, in Canada, the main big issue, the hot-button issue, if you will, is health care.
Now, you still have family back up in Canada?
I do.
And what is their opinion, would you say, of the system?
Generally the same. Generally the same. They appreciate their doctor, they like their doctors, and they just don't like the system. It's almost like a money pit.
Now, with you living down here in the United States and them up in Canada, I'm sure that this has been a topic of discussion. Now, from the media coverage that they get up in Canada, how is it covering this, and what is their angle you hear from there?
The angle that they're getting is more or less, I would say the same, that they're, in that they're saying that we're going to be changing to a more Canadian-style system. It's not really much of a debate. It's almost like a side issue. It's not very, it's not dominating the headlines like it is here in the States. I mean, it's a small issue to them, so they don't really pay much attention to it, I guess.
Now, but is it that Canada is looking at it as America or the United States is following Canada because they think that Canada's system's better, or do they think that you know, America or the United States is making a change for the worse?
I believe most of them would say that they're changing, they're trying to make it better, but it shouldn't necessarily be what they did. You know, Canadians right now, they want to change what they have, and they're scared for Americans that they're going to go down this wrong path and not be able to undo the things that we're doing now and doing it so quickly. Mm-hmm. And that's the concern, I guess, for Canadians, because at the same time, they still get a lot of health care here in the United States that they just can't get in Canada. And for some of them that do get those serious things, you know, serious medical problems like cancer, you know, heart disease and that type of thing, they are getting health care in the U.S., it's going to affect those people, and I'm not sure they like it that much.
Okay.